Hello, everyone, and welcome to our VelaShape III webinar. We're going to have a great discussion today with Dr. Jason Emer, who's located in the Beverly Hills area. We'll be discussing a little bit about VelaShape products and technology, as well as covering some of his own success stories and tips and tricks for marketing, getting more patients through the door, as well as clinical results and success he's had with treatment. So with that, we're going to go ahead and hand it over to Dr. Emer and let him get started on his presentation. Dr. Emer?
Thanks, everybody, for listening in. I know that on different parts of the country, it's different times, and it's probably late over on the East Coast, so I'm glad that we're all starting at a reasonable time. I'm going to talk today a little bit about my success with VelaShape III, how you can generate more revenue using the device and what it can be used for in your practice. My name is Jason Emer, and I specialize specifically, I'm a dermatologist that has been fellowship trained, and I specialize specifically in body contouring and liposuction procedures, skin tightening and cellulite reduction procedures. Most of my practice is cosmetic. So I'll talk a little bit about VelaShape III. This is a picture of myself. Most of the time during the week I'm in the operating room removing fat from people, and then the rest of the time I'm using devices like VelaShape to tighten the skin and get some good contour. And most of my patients, they'll come in, looking at pictures like this that they see at the store and want this type of result. In general, that's not the result you're going to get from devices that are on the market currently, but in combination with surgery, you can get results like that, or in the right patient, you can get very similar results to the person that's on the right. And so, obviously your patients are going to come in asking for things that instantly erase inches and slim the belly fat and without diet or exercise, but that's, not going to be the truth. But in the right patient, you're going to get a really good result, and I'll give you examples of how you can do that using VelaShape. My philosophy on weight loss is really that you should be targeting disproportion and creating balance. Most of the patients are going to come in and they're going to want something that's going to be a substitute for weight loss diet. And you got to tell them that the results they're going to get are going to be much better if they combine their diet and exercise with the procedures that you do. I think it's important that when the patients come in, you do a full body consultation, because at that time you really can understand what their expectations are and work to create a plan with the devices you have. Specifically, what's nice about this one, and we'll talk about that, is that it encompasses a lot of different things, including circumferential reduction, so fat reduction, as well as improvement in cellulite. Obviously, our patients want things that are safe, effective, quick, having low downtime, and inexpensive. So they're not asking for that much. But we at least have the ability with these newer devices to give them things like that. And so we'll talk today a little bit about the history of VelaShape, the technology, how it helps the tissues, and show you some pictures of my own patients and talk about what I do. So Syneron was the first company to pioneer use of radiofrequency in body shaping, and it was the first to receive an FDA clearance in non-invasive circumferential reduction. Many of the companies have really tried to copy this technology, and there's many that are out there, but this is the tried and true, the one that I find in my hands is the most useful. And I do, like I showed you in that picture before, a lot of surgical intervention, and even by doing a big practice that does a lot of surgery, I still am using non-invasive technologies like Vela to enhance my results. There's many units that have been sold, over 8,000 units, 10,000 procedures performed every day, many clinical studies showing the improvements, and we'll talk about those, and many patients that have been treated worldwide. And so Syneron's experience and research has been what is showing effective body contouring devices, and that has contributed to the success and improvement in the Vela technology over time. And so what have we learned from our experience? We know that heat is the main mechanism of action for collagen formation. So if you can get good amount of heating into the skin at the right temperatures for the right amount of time, you will get some collagen, which correlates to skin tightening. The other is that with controlled injury of the dermis, or with at least enough heat and time, you can also change the metabolic activity of the fat cell, causing them to rupture or to be lost and get a reduction in fat. The key is temperature and time gives you results. I'll talk about this later, but in my clinical experience using this device, you get excellent results if you do it for enough time. So it's very technician dependent. Most of my patients that we're doing treatments for, you're doing a range of somewhere between 15 and 25 or 30 minutes at somewhere between 42 and 45 degrees Celsius, and that has been proven to show that you will get those results, which are basically skin tightening and fat reduction. And the evolution of Vela has been over many years, and we talked about the tried and true technology launching in 2005 and now becoming more advanced in 2013. And I know a lot of people who are listening probably, think, oh, I've heard of Vela and it took so many treatments in the past to get results. It, didn't really work for cellulite because it always came back. The fact is that, do you still use your iPhone 1? You don't. People have an iPhone 6 because it's the newest and best in the technologies. It's faster, it's better. Same thing happens with VelaShape. As the years have gone on, and again, they were the first to generate this type of device, the technologies have improved. And they still have the most powerful and the one that has the most indications, particularly cellulite reduction and circumferential reduction of the abdomen. If you look at the chart, the radiofrequency power here has increased dramatically over the past years, even from the 2009 when the Vela 2 really had only up to about 60 watts of power in terms of the radio frequency. However, now we're looking at powers even 2 to 3 times that, about 150 watts. Incorporating both radio frequency infrared and the vacuum is what really makes this technology unique, and that is what allows you to basically hit every depth and every type of concern that you're looking for. So our goal, as I talked about before, really is to getting the right temperature and keeping it at that time period. But in the past, getting to that temperature really took a long period of time. And so not only did you have to wait a long period of time to get to the temperature, you then had to wait even longer during the treatment to keep the temperature. With this 150 watts of power in the RF of this device, you can get to that temperature really, really quickly. And the end point really is to maintain that temperature, and so you can maintain it and get to it much faster. What's also good about this, and we'll talk about this technology later, is that the radio frequency is a closed loop, which means that the energy is consistent in its delivery, and doing so causes the temperature to rise much faster. And so we can really be able to determine the temperature in the tissue below the skin. And so what are the features? And if you look at it, it's really attractive looking. It's got a touch screen. It's slim. People like this. This not only represents a newer technology, you're the one with the best device and the coolest looking, it also kind of resembles what the person wants to look like. They want to look slim. They want to look sleek. So it's nice that you have that type of look in this device. And like I said, the power is just increased. It's a closed-loop radio frequency. When the skin is vacuumed up into it, it targets depths in the tissue that is read with a temperature gauge, and so we know at what temperature we're getting to, and it's a consistent delivery. The higher energy means that we get more heated tissues, which means less treatments. It's no longer 10 to 20 treatments. In general, my patients are getting 3 treatments for about 20 to 30 minutes per area, depending on which area you're treating, spaced 2 weeks apart, and then they maintain. This is much different than the 10 to 20 treatments in the past. The other thing that's good is that, and we talked about, as the temperature goes up, most technologies, it's very fluctuating in terms of the power that's delivered, and because it's not a closed-loop circuit, a lot of times you can get burns. In this case, because it's closed loop, it's a very constant energy delivery. So if you look at the green line, as the temperature goes up, the energy delivery is still the same. Whereas in other devices, as the temperature goes up, the energy is going up, and that then risks the temperature rising too quickly and you getting a burn. So again, another way that energy increases efficacy as well as safety. And what are also the new applications? We talked about the design of the circuit, but the electrode itself has an improved contact with the skin, which means that the fat in the vacuum is sucked into the handpiece, allowing it to get much closer to both the radio frequency and the infrared energy. Because of that, you get more superficial and deep heating, allowing the tissue to be affected in a much better capacity. In the past, you didn't have such a good design. And again, like I said, you know, it's got a nice look, it's got this console, it's got multiple applicators, which we'll talk about, and a touchscreen control panel. So it's not only attractive when you walk into the room, but it also resembles what the patient wants to look like. There's some ports in the back, and it's closed, so it's pretty much hidden, and you can see that's how they attach. There is a foot pedal that's used, but you also have a trigger that's on the handpiece to allow you to not have to use the foot pedal if you desire. What's great about this is that there's two different applicators, and I know they've had this in the past. The V-Smooth, and they remember that because it smooths out cellulite, so it's typically used for the deeper tissue as well as breaking apart those septi, the collagen connections or the adhesions in the skin, any irregularities, or the V-Contour, which is usually more for fine-tuning and fat reduction. It's very easy to use. What's nice about the V-Contour is that there's different sizes. There's the small, the medium, and the large. The large, we'll talk about what each one of those are used for, but what's great is that it can pretty much be used almost all over the body, even though we have approval for the circumferential reduction of the abdomen and cellulite. The small can be used in other areas that we'll talk about. Their covers are disposable and relatively inexpensive, which is nice, and they're easy to clean, and they're pretty much optimal for almost any area of the body. Again, the small, the medium, and the large cover 3 different colors for the contour, and then the large V-Smooth. And you can see, I'll just make a little arrow here. You can see the little trigger here on the handpiece. So again, if you're not a foot pedal person, you pretty much can use the handpiece. What's also nice is there's a built-in temperature sensor. In my practice, don't always feel comfortable with all of the monitoring that the machines have. You know, there's always things that could go wrong. Have I seen that yet with this device? I have not. But we have an infrared external monitor, and I measure that on the skin as we're doing treatment, and it pretty much correlates with the handpiece temperature sensor. But if you have any questions about that, I can give you more information. What's nice is that it's built in, so it enables more of a precise treatment, and again, that will increase patient comfort. Most of my patients come in saying that they're coming in for basically like a hot stone massage. They feel like most of them are falling asleep, and they feel like they want to come to the office because it's very relaxing. They like that the temperature is warm and inviting, not that it's, you know, scalding and it's going to burn them. So what's the mechanism of action? It's powered by ELOS technology, which is basically proprietary to Syneron, and the VelaShape combines 3 different things, which is the bipolar radio frequency, the infrared light, and mechanical tissue manipulation. I'll tell you, I do not believe that any device that's on the market without some sort of tissue manipulation works. You have to have mechanical disruption of the adhesions or of the tissue, not only in this technology, which brings it closer to the RF or the infrared, allowing for increase in temperature, which correlates again to more collagen and fat loss, but if you don't have that, you don't break apart the adhesions, you don't break apart the septa, you're not going to improve cellulite. So those 3 technologies are the best combination. That allows us to get really much more in controlled thermal injury, and again, you'll get much more skin tightening, and you'll get better improvement in fat loss. Where does it work? And again, like I said, the radio frequency can go much deeper in this technology. It's got a lot more power. It's a closed circuit, so you can affect the fat, so you can get both the superficial and the deep layer. So we're not only getting the fat pockets, but we're able now to get much more of those fibrous septae and any irregularities or partitions you couldn't get before because there wasn't enough power. You can get that with this technology. So you can get improvement in cellulite, reduction in the circumferential and the circumference of the abdomen, and it increases the metabolic activity of the tissue. We have a lot of patients here that we treat. I did a liposuction case today in patients that have something called lipedema, and that's where they have an increase in fat number and size, and because of that, they also get tissue swelling. Their metabolism, their tissue is just not good. They have pain, they have swelling. We combine our surgical procedures with the VelaShape, and those patients heal much more quickly. Their swelling goes down much faster. When you use the mechanical manipulation of the tissue and also the heat, you're dilating blood vessels. That allows new blood vessel growth, which increases oxygenation of tissue. So it allows for much more improvement from the technology and what you're looking for. We know that fat cells can be easily disrupted. The issue is that you have to do it safely in a patient. And all of the fat cells are metabolically active. So when you deep heat with radiofrequency, it allows those cells to become more active, which results in either their decrease in size or their complete disruption. And that all is technique dependent. It really depends on how long you're using the device and how much heating you're getting. So in this case, we're looking to get that 42 to 45 degrees Celsius. I will tell you, most patients at that higher end can't tolerate it. But you'll have those few people here or there. If you go slow enough and you really increase the temperature in a controlled manner, they can get to 45 to 50. And if you're monitoring the temperature and you're watching the skin, it's safe. And you know that anything above that for a certain amount of time will get improved results. So in this case, we're combining the three technologies, and that allows us to stimulate the fibroblasts, improve the circulation, give us a little bit of lymphatic drainage. Like I told you, the metabolism of the tissue is improved, especially with the mechanical manipulation, the vacuum that's on this device, but also because the blood flow is increased, and you're also causing a sort of reaction or inflammation that occurs in the fat, allowing new good cells and healthy cells to come in and replace with new tissue. And so what do we see? If you get enough output of the radiofrequency and enough of the heat of the infrared on the superficial skin, you will get improvement in skin laxity, so skin tightening, and a decrease in volume, which is fat reduction, so an overall improvement of the skin texture and the shape of the body. And, you know, here's a histological result showing an upper arm that wasn't treated on the left, which shows, you know, reasonable collagen, not too much solar elastosis. But here, after a month, after some treatments, you see the thickening of the collagen in the tissue and slight increase of the epidermal tissue. So improvement both in the skin tightening and also in the collagen. And like I said, you know, we can continue to go into the mechanism of action, but the reason I think the vacuum is so important is because it causes vascular dilation. So your patients afterwards will say, I'm swollen, it doesn't look as good. Some of the patients that are coming in who are just looking for skin tightening or wrinkles, afterwards they love their skin because it's swollen, so they don't see the wrinkles anymore. That's due to the pressure that's caused in the vacuum, causing the blood vessels to dilate. So immediately you're going to see a response, and that's going to be swelling. But that increases circulation and improves the lymphatic drainage and stimulates the cells on the fibroblast, not only from the trauma, because we know trauma can affect the fibroblasts to produce collagen, but also from the heat that's being released from the RF. The other thing is, like I had sort of elucidated before, when you draw tissue into the device with a vacuum, you're allowing the fat and the skin to get closer to the radiofrequency. That allows for deeper penetration. That is why with the higher power that's on the VelaShape, you can get a much stronger stimulation and improved results, unlike everything that's seen in the past. So if you look at here, as the temperature increases in the tissue, you get much more diffusion of oxygen. So basically you're getting improved oxygen delivery. And before I really was doing a lot of the research on this, my lipedema patients and my patients that would come in with postoperative swelling from liposuction, you do a Vela treatment on them, they get more swollen for a day or two, but then all of a sudden the tissue improves. You see a much better improvement in texture. You also see a much quicker healing time, and the patients just say that their tissue is better. I've had patients that have had lower extremity pain, a lot of that due to swelling, and when you do the Vela treatments, because their metabolism is improved, the pain goes away. And like I said, the deep heating from the radiofrequency and the infrared increases the oxygen, allows nutrients to get into the tissue, also increases the metabolism of the fat, which decreases the size of the fat cells so they shrink, and that causes less tension on the fibrous septae, improving the results seen in cellulite, also stimulating fibroblasts to produce collagen, and you will see an immediate skin tightening, but also some tissue swelling, and that's why you see some of the improvement immediately in the skin wrinkling. Here's an example of what happens when here is a normal fibrous septae with dilated or enlarged fat cells. As we do treatment, you can see that the septae release and relax. Also, the fat cells shrink, allowing the skin to elevate, so you don't see as much of this cellulitic dimpling. Now, is this permanent? Most of the patients will see a result that's long-lasting. Now, the question is, how long does it last? It all depends upon how bad the person's tissue is, what they're doing with their diet and exercise, what's their muscle tone like, and that sort of thing. So I tell all the patients, this is a treatment you do and you maintain. It is not something you just get once and then you can get a result. You do this in a series, you'll get improvement, and then you do your lifestyle modifications. You include this in your everyday or every month or every 2 month or every 3 month treatment, and you will continue to see the results as well as maintain the results that you might have had in the past. How do you pick the best person? Well, if you look at this chart, many women worry. 70% of most women will say they worry about a tummy bulge, and we know that most people want to change their body. Now, I have a very interesting practice. I have a lot of patients that come in for, a lot of women that come in for body contouring, but a lot of men as well. And there is an increasing demand in that. I know particularly it says here there's increased patient demand, and we do see it a lot in the male and the ethnic patients. And the ethnic patients are worried because they think, oh, is this a laser? Is this going to cause my skin to be scarred or become dark? It doesn't. Radiofrequency in the controlled depth bypasses any issues that we see in the epidermis, and it can allow improvements in the specific things we're looking for, so you can treat every skin type. And what's nice is there's this increase in men and males, and a lot of times they have localized areas, and those localized areas can be easily treated with a non-invasive device. So even though people have tried diet, most people have tried diet and exercise, and most say they would consider doing more, you want to offer them something that's good. And this is one of the things that you can do with almost no downtime, and they can go back to the diet and exercising the next day. What is the indications? We've talked about this. Basically, temporary reduction in the circumference of the abdomen and thigh, as well as improvement in the cellulite. Like we had said before, in the lipedema patients that I've seen, there's improvement in aches and pains, particularly swelling of the lower extremity, because you get this improved metabolism of the tissue and blood flow. It's also indicated in Canada for cellulite and circumference reduction as well. So who's the best candidate? This is really not for people that are obese. Especially for cellulite, you really want to focus on people that have more mild to moderate cases. The severe cases really are going for surgical intervention or combination treatment. But you don't want people that have too much loose skin where they really need a tummy tuck, or too much cellulite where they really have obesity or they need combination treatments. You don't want people that have lower extremity vascular disease, like lots of various viscosities, and you don't want people that don't have a healthy lifestyle. Your results, those patients will come back and they will say they didn't get an improvement, and that's because they weren't doing anything at home that you asked. This is a combination of lifestyle and of the treatment. And so how do you classify cellulite? Most of your people are going to be in the class 1 and class 2. This is where in class 1, there's really not spontaneous dimpling, but when they're pinching or they're moving, they see it. In class 2, they're seeing it while they're standing and while they're looking in the mirror. Particularly, these are the patients that shine the bright light over their buttock or look for a side light because they know they have something and they're looking for a shadow that's there. They're the ones that are come in and point out the 1 or 2 spots and be very particular. You want someone in between in this class 1 and class 2. The class 3 people that have spontaneous dimpling as well as worsening when standing and lying and they're obese, or they're very genetically inherited condition for cellulite, those are not really the ones you want unless they're really willing to make other lifestyle modifications as well as potentially go under procedures. Because like I said, this improves the metabolism of the tissue as well as the circulation, and so that will allow your treatment results to be even better if you're doing a surgical procedure. So your good candidates will have localized fat bulges, a regional area of volume issue, whether it be a flank or a stomach or the banana roll or an arm fat, and they have realistic expectation and will combine this with a treatment plan, specifically one that includes lifestyle modification, diet, and exercise. We have anti-aging physician that we associate with who gives supplementation for fat loss, supplementation for increased metabolism, supplementation for prevention of cancer, as well as other comorbid conditions that may be associated with cellulite and fat. And so how do you get good results? Well, you want to associate the treatment plan to what it is you're doing. So for example, if someone comes in, they have both fat and skin laxity, you really want to focus the treatment on what is bothering them the most and can get the most result. Like I said, the temperature has to be maintained at a certain amount for a certain amount of time. And in certain conditions, you can affect the fat, and in certain conditions, you get skin tightening. And you can get both with one treatment, but you really want to design your protocol for the issue you're treating at hand. So whether it's cellulite, and I know most patients are going to come in and say they have everything. Well, in that case, you might want to tailor a more longer series, one part to target the fat, another part to target specifically the cellulite using different applicators, which we talked about. So you want to look at how large the surface area is. You really want to assess how many treatments are going to be needed, whether or not they need to do one of the handpieces, whether they need to do both, whether they need to combine them in one treatment, and assess globally, are there other areas of concern? And this is where my philosophy came in. When a patient comes in specifically asking about body contouring, we really should look at their whole body. Assess, do they have areas of disproportion? Do they have good muscle tone? Do they have laxity of their skin? Or do they have poor texture and tone? That is going to make a difference for your treatment. If someone is 80 with a ton of skin laxity, their fibroblasts are just not functioning that well. The result you're going to get from VelaShape or even surgery is not going to be as good as somebody that's 20 or the 30. So you want the people that are, again, not obese, at a younger age, have good skin, healthy skin tissue, and have localized areas that they have good expectations for. And you really want to assess that. So your candidates include something like this. On the left, for example, regional volume. So maybe it's the abdomen, maybe it's the flank, maybe it's the thigh, but they have areas where they can get improvement and maybe they don't want surgery. Here you can have targeted sculpting. I see a lot of patients like this. They look great already, but they want something more. The Vela is amazing for that. It's got a lot of power. It can deliver a lot of energy to the skin, so you can enhance their already amazing improvements that they've had from diet and exercise. You can enhance that. Do you want to get ab sculpting? Do they want to have more skin tightening? Do they want to have something that I just say age prophylaxis or prevention of aging? They can do that with this without doing any surgery. And I'm not to bring up other devices, but certain other devices require a certain amount of fat, or they require a certain amount to go into a device to be able to work, or they have a lot of pain. And in this case, in these specific cases, you can use the Vela to treat, and there's no restriction. The third one, again, post-baby laxity. This might be the patient, or same thing with global assessment, who might be the patient for surgery. If you do surgery, it might be a good combination. They come in, they're a good candidate for surgery, they're willing to do it, they do it, and then you combine this treatment afterwards. All my liposuction patients get Vela treatment after and sometimes even before the procedure. Again, other acceptable patients include some with mild skin laxity. You really don't want to pick the patient that is a tummy tuck candidate. They are not going to have good response in their tissue. The tissue is too loose. You want people where you pinch the skin and it goes back. You don't want it where you're pinching the skin and it's falling and it never comes back. Cellulite, if you look at this picture on the left, the patient has some deep dimples and they're there at rest. You can get improvement in that. Same thing with this patient that has a little bit of a hangover. You can get improvement if they're not willing to want to go under the knife. And you want to avoid people that are too thin, although I will say I have a lot of models, a lot of patients that come who are doing infomercials or are trainers that are doing photographic events and things like that, who just want to look a little bit better. You can change the device to give enough heat and very safely to just tighten, to decrease swelling, to get rid of any of that fluid that's there during your period, during your month time, because you get a little bit more swollen. This will improve that. Patients that are obese, excessive laxity, or visceral fat, which I didn't talk about, these are the patients that come in that look like they have a belly, but it's really all inside. Those are the patients that really need to go, and you need to partner with a Pilates instructor, a yoga, a nutritionist, a personal trainer, somebody that can tell these patients they need to lose the internal fat before anything can be done on the outside. Now, you can treat the outside as long as they have reasonable expectations, but it's not going to improve the bulge or the protrusion forward of their belly because it's all internal fat and you can't affect it. The RF, unfortunately, doesn't go that deep yet. How do you prepare the treatment? So the goal to any of these procedures is improvement, not elimination. You want to set the expectations. We talked about that. Most of the results are temporary, but I will tell you, in the right patient who is young enough, with good skin tissue, with only localized areas, they might get permanent improvement or get on the right track with their diet and exercise and just take off. Skin laxity can improve, but again, you don't want the people who are hanging over, who are candidates for a tummy tuck. And you do see improvement in stretch marks and scars, and then that's also because of the fibroblasts that get stimulated in the production of collagen. Diet and exercise does improve the results. I know it says here that it's not essential. My patients, it is essential. I tell them, you're going to come here, you're going to spend a lot of money on these treatments. Will you get a result from them alone? Yes. Will you get a better result if you combine this with exercise, with diet, with other things at home, such as supplementation or anti-aging treatments? You will, and honestly, they'll make your before and after photos look better, so you might as well ask them to do it. And weight gain can negate or worsen the results. Who is a contraindication? Anyone with specific heart disorders, cancer, pacemaker, defibrillator, especially unless it's directly over the treatment, pregnancy or nursing, because this is an energy device specifically on the abdomen, with any other comorbid health conditions, specifically if you're doing thigh or stomach or vascular disease, dilated blood vessels, impaired immune system, specifically if you're worried that they're not going to get that collagen stimulation like other people would who are normal immune systems, or any diseases that might be stimulated by light. But specifically, this light is typically not affected by most of the conditions like polymorphic lysoropsin or lupus, which are more, or drug reactions, which are more towards the UVB spectrum anyways. So most of the time, we're not really having much contraindications to treatment. Anything that is affecting the skin in that treatment area that's active, such as psoriasis or eczema, very dry skin, fragile skin, scars, or any open wounds, those are the people you don't want to treat. If they're on blood thinners, you really have to be careful about how strong the vacuum is, especially if they have a history of senile or actinic purpura, or we saw senile purpura, bruising because they're on blood thinners. If they have lymphatic drainage issues, I'm telling you, I have seen improvement, but it's not always the best idea to just go ahead and treat somebody specifically for that. If they've had any treatment, a surgical procedure in the treatment area. Now, I'm a little bit of a hypocrite because the patients I treat 3 weeks to somewhere between 2 and 4 weeks after they do liposuction, I have them do VelaShape treatment because I find that it gives an improvement. You can treat over a tattoo or permanent makeup, but you just have to be very careful about watching the skin. So the procedure includes, obviously, we just talked about proper patient selection, pre-treatment of the skin. Most of the time you can't do the treatment if it's excessively hairy. You can do some hairy, so I tell people usually to trim, to be clean when they come in. We define the treatment areas, take pictures. I don't particularly weigh the patient because I don't think of this as a weight loss procedure. I think of this as a contouring procedure. So for the photographs are really essential. Measuring the circumference is extremely helpful. We're extremely busy, so I typically don't do that, but my patients will tell me that they've lost, a pant size or two, that their bra, if we're doing a bra fit, now fits differently and they have to do a different size. Same thing with their arms. If they're wearing Lululemon, they can tell me that they don't see the bulges anymore, that sort of thing, because they're wearing those tight Spanx or Lululemon type pants and shirts that show everything. In this case, they don't see the bulges as much, so they're really happy. And you want to make sure that you position the patient. This is the most important part of this procedure. You know that there is a massage component, there's a mechanical manipulation that allows the tissue to go into specifically into the handpiece, and you want to make sure that that is done properly, because if it's off even a little bit, you could get a burn, particularly if the handpiece is not 90 degrees to the treatment area, and we'll talk about that. The positioning is by far the most important thing, besides having a nice layer of the VelaShape, which is a lotion that you use to allow the handpiece to glide smoothly over the tissue to allow it to generate the heat and go into the applicator very easily. And setting the parameters is really important. So looking at this, this is a good treatment area, an abdomen, a nice young patient that has good skin tone, maybe a little bit of volume that they want reduced, but a good amount of the VelaShape. The parameters can be set by both the handpiece and the touch screen. I typically like doing everything on the touch screen. I don't use the gauge. I don't use the gauge that's on the handpiece or the button to activate, because I think it's a lot harder. I like to have my hands positioned properly so I don't get any carpal tunnel or any hand issues long term. So I hold the handpiece in a different way. I don't hold it like that. But it's nice because the touch screen is very easy, and if you have someone in the room helping you, it's very easy to change. This is the screen. It's very simple. It's touchpad, so little options. You can slide up just like an iPhone, and you can select your parameters. The other thing is you can set the temperature that you want. So on this gauge, you can see it's going up to 43 degrees Celsius. That's the set temperature, but the temperature on the handpiece around the skin is really only at 27 degrees. So too little to get a result, but this is the start point, so this is how you set the temperature and you move. Treatment protocols. So let's talk about that. So in general, you know, I'm tailoring my cases to combine a lot of conditions, whether it's cellulite, localized fat, skin laxity. So I'm sometimes using both of the hand pieces. But there's two particular hand pieces, the contour and the smooth. The smooth is, again, smoothing out the cellulite. So in general, that one in particular is just for cellulite, but you can get significant deep heating from it. And I have seen improvement in all of the parameters, including localized fat reduction and skin laxity. With the contour is really what your go-to handpiece would be, especially if you're looking at this for fat reduction, circumferential reduction of the abdomen and thigh. There's a deep mode, which is a large handpiece. I'll show you that, the larger and flatter one. That can work great for localized fat deposits. It gets the tissue temperature up very high, allowing the fat cells to be disrupted relatively quickly, and you can use the small handpiece for submental and for underarm as well as inner thigh contouring. So what do you do for circumferential reduction? So you can treat focally or you can treat large areas. We call this the 360 torso or the 360 thigh. It can be adjusted to treat different areas of the body, but again, improved for circumferential reduction of the abdomen and the thigh. And there's different templates. I don't particularly follow the individual squares, but it makes the learning curve relatively easy, where you're defining out each square is 5 by 5, and large sections 25 by 20, medium sections 15 by 20, and small 10 by 20. And that allows you to really stay focal with the area you're treating and increase that temperature slowly, get it to the temperature that we need, so you're not sort of going all over the place and it's causing heat dispersion. You really want this bulk heating to increase. It's the only way that you're going to get to the temperature and maintain the temperature for significant enough time that allows it to get a result. And so you can define out the area, you mark it. My patients, we just use a white pencil similar to this. And what are the standard parameters? Well, most of the time, people are using the medium cover. I'll tell you that I have progressed in my treatment protocol, and I do most of the treatments myself. I charge a significant more cost, but my patients really want that. But in general, the approved parameters to use a medium cover. This is your go-to handpiece. And infrared really should be turned off when you're stacking. Now, if somebody has more skin laxity, you can stack the infrared. You just have to watch the skin. Be very careful. What you do is you keep the RF as high as possible, and you stack the treatments at the beginning. We'll talk about that. That builds up the tissue. You snake around, and as the temperature increases, you lower the radio frequency to maintain. The vacuum, I typically keep at the highest, a 3 or a 2, but the inner thigh, I do 1, and same thing on the neck, or sometimes not at all on the neck. And you can, again, adjust the radio frequency based on your patient's tolerance. If they have pain or if the temperature goes up relatively quickly, then you lower the RF. And the goal is really to comfortably increase the temperature increase the temperature comfortably over time, relatively quickly, and maintain it for the amount of time that we talked about, which in my practice is typically 20 to 30 minutes, but in the studies, you can go as quickly as 10 to 15 minutes, you can see a result. So in the first pass, we stack pulses, and you snake through those squares that you have defined on the body. And again, proper positioning is important, and we can talk about that. Trainers, if you decide to get the device, can come and explain that to you. But you stack it in 5 stack pulses per segment, and then in the second pass, you go to 4, then you go to 3, then you go to 2. And you should pretty much be at that temperature, which is 43 to 45, and once you do it, you then snake to maintain. And so this is a picture showing both vertical and horizontal snakes. You know, I switch between them. I think that the most important thing is you're constantly moving. You alternate between the snake patterns so that the applicator is not on one given area for too long a time. You don't want to burn somebody. You don't want to rapidly increase the temperature so quickly that you can't protect the skin. And then you want to maintain afterwards, especially being careful over curved or bony areas. So here's the abdomen picture of how you would set this up. We call this the high definition protocol. This is where we treat the anterior abdomen and the flanks and the back. I have a lot of people that come in for all this at once. Sometimes you can do the high intensity protocol, which is a 30 to 45 minute treatment in each of these sections. They come in for one and then they wait and we see the results. A lot of times I see that improved in my patients that are going to go for photo shoots, or they've maintained, you know, they do well on their initial cycle of the 3 treatments for 20 minutes, and then 2 weeks apart, and then they come back, you know, every 3 to 6 months, and they get one of these large, 45 minutes, 30 to 45 minutes per section. But this is basically showing how you could set up an anterior abdomen, flank, and posterior abdomen. You can see the large section in the middle, the smaller sections on the side corresponding to the sizes, as well as in the posterior abdomen doing a medium, depending on the patient size. So again, cycle 1 is stacking your pulses. 3, 4, or 5, you do it in each square, then you move on until you get to maintenance where you're continuing with 1 to 2 pulses in the area, or you're just snaking throughout. I typically keep reapplying the spray as you stack, as well as when it looks like it's not gliding as well, or when it's a little dry. If the patient can tolerate, go to the higher temperatures. Just watch the skin. If they can't tolerate, adjust the radio frequency down. Once they get to temperature, you maintain it for at least 5 minutes per cycle. I mean, I tell people 10 to 15 minutes. Typically, I'm doing a 20 to 30-minute treatment. And so this is just a picture showing how you could hold the device. I particularly don't like holding it like that. Your wrist could get hurt, so I hold it with 2 hands, 1 hand on the head, 1 hand on the top, or on the actual cord that goes to it, and that allows me to get 90 degrees, but you would stack pulses here and then move to the next square. After that, you maintain. And again, this is just a set protocol. If you're watching the skin, if you're being careful, you can stack the pulses correctly and then maintain with just snaking around afterwards. And so here again, showing you a picture. It would be nice if we could show a video, but this is showing you a picture of maintenance after the temperature is reached, doing a vertical snake. And then you would continue doing that for at least 10 to 15 minutes. I typically offer my patients a 20-minute treatment since I charge them a little bit more money, but if they do the high-definition protocol, we go a little bit longer than that. How do you treat the thigh? Basically the same thing. I do one large area, and then I sort of snake around. Here it's showing you on one side, you can do this medium and a small, as well as on the other side doing a large. It's not really that defined. You just want to make sure you're not overlapping pulses too much. You're doing your stacking, and then you're maintaining afterwards. And here it's showing you the redness. Let me just show you here. There's redness that's being shown here in a square pattern, and that typically is, I could show you that here, right there, and that's typically because the applicator has passed that area. So you know the temperature is there. If you're worried that if you want to compare the internal temperature to what the skin temperature is, or the handpiece temperature to what the skin temperature is, I have an external monitoring device where I just shine it on the skin. I use this for smart liposuction for other things, and it usually correlates exactly with the stacking procedure. This is results, not mine, but these do show improvement in the abdomen. You know, it's very hard without three-dimensional imaging to show circumferential reduction, but you can see an improvement, particularly in the belly bulge, which is right here. There's a reduction there. Also, specifically in this contour, you can see this is much flatter and much tighter than it was before, even in one treatment. Another one, again, one treatment, much less of the bulge. That's hard to say, and you also can see some skin laxity that's here, much less, but if you're doing the measuring, you're going to see circumferential reduction. Again, same here, this person is pushing out, they have a little bit of visceral fat, but there's some improvement in their waist, some improvement, particularly if you look right here, you can see much tighter contour there, and an improvement in the hip area, abdomen, and waist, all just in one treatment. So how do you get rid of localized fat? A lot of people are coming in now. I know people are comparing these devices to cool sculpting or other things that are large, you know, on the market. Again, it's difficult to say. Cool sculpting is a different technology. It's a different type of inflammation. It's not going to give you the influence and skin tightening that you're going to get, so you're going to get a completely different result. As well, cool sculpting is limited to the fact that it has to go into an applicator and fit into the applicator. Certain patients can have it. In this one, everyone can have it. In the deep mode, which is this large, very large applicator of the V-contour, you use this first to get the bulk heating, and then you go switch back to the medium handpiece, and you maintain it afterwards. So same areas to be treated, it's just a deep protocol. So what you do in a larger area is you're then cycling between these 9 segments using the large cover, and you're stacking that just like we talked about before, but with the large cover, that stimulates a significant amount of deep RF that increases the temperature rapidly, and then you switch over to the medium cover to maintain. Again, more of these diagrams showing how you could lay out the procedure, but you know, it's not going to be that well defined. You really want to individualize the treatment with each patient. And in this case, they're showing you how do you do this deep mode protocol. Well, here they're doing no infrared, and you have the RF at 3, which is one of the highest. This is the highest, and then you're stacking the pulses. So 4 stacked pulses per segment in each of those 9 areas, then 3, then 2, then 1. Then you can maintain by decreasing the RF or stacking the pulses with a medium handpiece. So in general, you do not want to lower the RF until you maintain temperature, until you get to your temperature. Then you want to decrease the RF so that it maintains and you snake throughout the area. So this is showing you the deep mode. Here's the large applicator. You would stack this 5 times, move on to the next square, and stack that 5 times, move on to the next square, stack that 5 times. Do that same thing over until you get back. Now you're doing it 4 times. Move, again, all of those areas, come back until you get to temperature. Once you get the temperature, you can go right back on to the medium and continue that with snaking. So here it's showing you that, again, that same parameters, and they have a reference guide for that. Here's showing some results where just the right side was treated, and there's a significant reduction even in one treatment, and I do see results like this. Same thing here. very good results on the upper back, or sort of kind of the broad fat area. It's a little bit lower, but the upper back, 1 treatment improvement. These are much more significant improvements than most people will get. You know, I tell people if you can get 20, 30% improvement in a series, you should be happy, and most patients are if they're not considering doing liposuction. Smaller areas can be treated with some of the hand pieces, particularly the small V contour can be used on the neck and the submental area and the arms. This is off-label treatment, but I see very good results with that. Yet, I am combining this with neck liposuction. I'm having patients do a larger treatment prior to the liposuction, then we do the liposuction, then they follow with the treatments afterwards, and I see great results. You mark the area. You do not treat over the cartilage or the thyroid. And in this case, the vacuum is extremely low. You typically will not use the infrared. I have used the infrared where there's some wrinkling of the skin because you want superficial heating, but you got to be very careful and monitor the skin temperature because you don't want to burn the patient. You start at a very low level and you incrementally increase as the temperature goes on, putting a very good amount of the VelaSpray. And again, stack the pulses, move throughout. Once you do each of those passes, get the temperature and maintain it. Same protocol for every area. This is showing you how you would have the patient, and a lot of patients like it because there's a massage that's on it. This is a decent result after 3 treatments for someone that didn't want to have surgery, and you could see a significant improvement. Is this a home run? No. Is any of the non-invasive devices a home run? No. Can you get improvement with other things in combination? Yes. Can this improve your surgical results? Yes. But does this make patients happy? Are we seeing something significant? We are. We're seeing contouring of the jawline. You're seeing a reduction in the volume of the submental area. Patients are happy when they see a result. Younger patients are going to get much more of a better result. This is not my patient, but you're seeing improvement in the submental area as well as some of the skin wrinkling. Cellulite reduction, again, treatment areas defined in a protocol. You know, I snake throughout these areas, raise this to temperature, move to the next area. You really want to focus on an area, bringing it to temperature, and then going to the next area. You can use these templates in any of the different areas. So here it's showing you anterior thigh, where you would snake or circle in this area, stacking pulses or maintaining, and then you would move on to the next and keep going and go back and forth as the temperature and keeping the temperature at that level. It shows you here how you can maintain. I typically like to snake throughout the entire time. I used to do the clockwise manner first in the first cycle, then the second cycle. That allows you to bulk heat. But I find that patients at a very high RF, if they can tolerate it, even get the temperature at the snaking. So it's not one and done. It's not that you are set to this specific protocol, but the approved protocols to get the best results are these, and you have to maintain at temperature for at least 15 minutes. And like I said, we go at least 20 in our practice. You see how the cellulite handpiece or the V-Smooth, remember, smooth out your cellulite is much larger. I typically like to hold right here and here. It's much better for your hands. So in my patients, I wrote here, I do 3 treatments, about 20 to 30 minutes each. Every 2 weeks, I try and maintain a temperature of 45 to 50 if they can tolerate it. Maintain then afterwards every 3 to 6 months. Cellulite may need more treatments, typically 3 to 6 in the first cycle, and then you maintain. You really want to combine this with other surgical modalities or non-surgical options because you're going to get a more result. If patients want surgical-like results, they have to have surgery. If they're not willing to have surgery, you can use it independently or combine it with other options. No one protocol is correct. The following protocols that we've described here with the set templates and stacking and moving and then maintaining is what is going to get you an optimal result. Can you play around with that? Like I have, you can and you will get good improvement in not only fat reduction, but skin tightening, and fat reduction in cellulite, but also skin tightening. And I see improvement here in knee wrinkling. Patients love it for that. This is a result that I'm showing you here of a patient of mine, VelaShape. You see she had some wrinkling on her anterior thigh, improved after a few treatments. Same thing here, you see the wrinkling with improvement after a few treatments. Same thing here, a thin patient. You know, again, one of those things where we said maybe that's not the best patient to do treatment on, but I'll tell you, you can get tightening, you can get definition. These are for your patients that want something more. They're already dieting and exercising. They want to maintain. They don't want to look like grandma when they get older. So they want to do this treatment earlier, and you can offer it to them because it works, and you can see the results here in a thin patient. Same thing here in a patient that has a little bit of a back bulge. This is the deep protocol where you're using a large V-contour handpiece. You're stacking the pulses to get it to temperature, then you're maintaining with medium, or sometimes I use even the cellulite or the V-smooth afterwards, after the temperature, to maintain it. Same thing here, improvement in the back bulge. Cellulite can be improved. This is a patient, you can see the different areas and improvement with the V-smooth handpiece in the protocol for cellulite. So what are some tips and pearls? The most important thing are the T's. The 3 T's, don't forget them. Temperature, time, and patient tolerance. You want your patients thinking this is a massage, so they come to you often. You don't go to a masseuse once for a stiff neck. You're going often. This is the case where if somebody has cellulite, they have skin wrinkling, they have some fat, they want to come to you. You're going to do these treatments, you're going to get a result, and you're going to maintain it. And the best results come from getting to the temperature in a short period of time and then maintaining that temperature for a longer period of time. If you need to, you adjust the parameters, you can decrease the number of pulses that are stacked, and basically you can snake throughout the area so you disperse the heat, but you're maintaining it. I had elucidated, or had sort of described this before, that most of the time you're doing 3 treatments and you're doing them 2 weeks apart. That can get you a significant result. For cellulite, you're probably doing more. If they have a localized area of fat, maybe you're doing it less if you're doing a deep protocol. But you can do what we call the high def, or the large responsive single treatment. It's 1 treatment. You perform it basically twice, which is 30 to 45 minute treatment in 1 area, and you want to maintain the temperature of 43 to 45 degrees Celsius. Like I said, for my patients, I try to do 45 to 50, and watching the skin and making sure that the tissue stays hot. That's the most important thing. You want to be comfortable. I don't like to hold it like this. Again, I hold the connector as well as the handpiece so that my hand doesn't hurt. You can use the trigger. I find that using the foot pedal is a little bit better for me, so I don't get carpal tunnel. Patient positioning is extremely important, so if you do decide to get this device, we can give you some advice on that, and they can do some training. It shows you here a flank of a patient that's being treated. You see the towel going underneath and pressing up the posterior part of the back, and that allows it to flatten the area and really lift off the tissue to the device so that you get a much better connection and less risk of any complication. And here again, using the towel at the patient positioning is extremely important. It gives you optimal exposure to the area that needs to be treated. The other thing that's very important with this device is that the filter is maintained. Every 30 minutes, and maybe I'm a little bit anal, I have them change it much quicker, about every 15 or 20 minutes, but they can be reused, you just clean them. So when can you see results? I tell patients even at 2 weeks you can see it, even at immediately, but you're going to see the results relatively quickly. Maintenance is required, like we talked about, and the difference between the other treatments is that, and the other Velas, is that this is much more powerful. Is there a difference in patient outcomes? Yes, the VelaShape III is much better. It's like the new iPhone. It's always improving. And are they comfortable? They are. If you maintain the temperature properly, patients will come back thinking this is like a hot massage. So thank you, and if you guys have any questions, we can answer them now. I know I went a little bit longer, but I wanted to give you some advice here. I can talk a little bit about marketing in the practice as well. Since I do a lot of surgical intervention, this is something my cosmetic coordinators and myself are talking to my patients about all the time. And there is an advertising campaign that Cineron has that's been very helpful that I think we can talk about.
Okay, well, we'll go ahead and start in talking about the questions we've received so far,
okay,
just so you can catch up on that, and then we'll go into some of the marketing. One of the questions that came up, can you talk a little bit about how you sell patients on a new treatment, and what about staff training and cross-promotion, what you're doing?
Sure. So, most of my patients are coming in asking for either surgical or non-surgical. They want something. So I individualize the treatment. I look at them and I say, is this a patient that is surgical or non-surgical? If they're surgical, I really do push them towards doing one treatment that's going to get them the ultimate results, which is the full contour they want with surgery, but then maintaining the results with diet, exercise, and VelaShape. If they are a candidate for anything non-surgical and they don't want surgery, then I have to decide which is the best non-surgical option for them. A lot of the patients that have cellulite, there's really nothing that works well. This is the one that works the best in my opinion. For people that have skin laxity, this also improves that, where a lot of the other devices don't, which are truly just for fat loss. You can use this in multiple areas, which is really, really nice, especially in the submental, the arm, the thigh, and you can use them both areas. So you have to sort of individualize the treatments. I offer all the different options that we have, and I do have a lot of other non-invasive fat as well as skin tightening devices, but I find that in my hands this works the best, and patients are always satisfied wanting to coming back for more. I haven't seen improvement in other devices for things like leg wrinkling, the thighs like I showed you, the neck area, the inner thigh. Those are very difficult areas to get both improvement in cellulite, fat, and skin tightening. You're getting all of those with this device. My staff is very well trained on the procedure. We have had multiple trainings. They know about the device. They know how to talk about the device. They know what I think about the device. So they sell that to patients. But the biggest thing is that you can train somebody to do this, but I will say I am offering it at a higher cost to the patients for me to do it, because then I can cross-sell them. Now, what's nice about the devices, they're there for 20, 30 minutes. You can talk to them about other things, and people do want to combine stuff that's skin tightening as well. So if this is going to improve it, you can use this, and then with other things that either Cineron has or others to use for skin tightening as well. Did I answer?
Sure. Go right into the next question. So you'd mentioned technician dependent before. Can you expand on that?
Yes. So I think training of staff is extremely important with this device and with any non-surgical device. I mean, cool sculpting even, you need to make sure the applicator is put on properly. If it's not, you can get no improvement. You can also get a ridge. With this, the important thing is that obviously one is safety, so you do not want a burn. That's why you need to have a good amount of the Vela spray. You need to have good patient positioning so you have 90 degrees to the applicator and good suction. The second thing is maintaining the temperature. If you don't maintain the temperature for 10 to 15 minutes at that 43 to 45, you're not going to see a result. So that's what I mean by technician dependent. Whoever you're training has to be really closely monitoring the temperature so that it stays at that temperature for 10 to 15 minutes. If you don't, you're just not going to see as good a result.
Okay, next question is, what are your best marketing tactics? How do you drive patients to your business?
I think because we're a body contouring center, we have a lot of patients that come here, but I find that e-blasts are very, very helpful. Nighttime events we do once every few months, where if they come in to learn about a procedure, they get a certain amount off a series. I combine Vela with all of my surgical procedures so that they get a little bit of a discount on the series, so that they're willing to do the series even after the surgical procedure. And those are really the main things. I say events and marketing campaigns that we send out. We do advertise in some local area, and our website has things on there. I do think making a video or showing that on social media, I do a lot with social media. I'm not saying this is the best thing, but showing yourself getting the treatment done on YouTube or on a site really does drive in a lot of patients, more than you would think.
Okay, going to go to the next question. You mentioned some of these earlier, but it might be good to recap because we went a little bit over, but can you talk a little bit, one of the questions is how often do you do treatment and what kind of reduction have you seen with your patients?
Yeah, so most of the time I'm seeing a pant size or two, similar to what I've seen with liposonics in the past, but a lot of times, at least with a series of treatments. Now with cellulite, I showed you some pictures. You need to do more treatments. In general, I'm offering a series of 3 for about 20 to 30 minutes of treatment every 2 weeks. That's on my patient tips slide. And then after the 3, they maintain every 3 to 6 months. If it's for skin tightening and they want a little bit more, we do more. I've gone as early as 1 week. I've gone as late as a month or 2 and seen improvements. For cellulite, I'm telling them they need at least 3 to 6 treatments, but you do see an improvement in 3, and then I have them do maintenance after that. This is sort of not a one-time treatment. This is you're going to get an improvement, and if you want to maintain it, you have to continue doing treatments after that.
Okay, next question is how quickly do patients see results? And I think you kind of answered the maintenance portion, which was part of that question, so you can go into that.
Yeah, so there was a question that said how quickly before on our slides. I tell people within 2 weeks you can see improvement. I have patients that claim the next day they see skin tightening. I really think that's from a little bit of the vascular dilation that we talked about with the massaging. But you do see improvement within 2 weeks. I would say by 3 months from the first treatment is when you see the best results. That's because the trauma from the massage and the heat from the RF and the infrared are stimulating fibroblasts to produce collagen. That's when you're seeing the collagen production, just like a laser.
Next question is, what other systems do you own for body contouring?
So I've used Cool Sculpting for many years in the past. I stopped using it only because I'm doing a lot of revisions for people with Cool Sculpting, and I also thought that to get the results that I got with body contouring with liposuction, it would cost you so much more in Cool Sculpting. So I stopped doing that. I use Liposonics, I use UltraShape, I use VelaShape, and I have Venus Legacy, and what else? I'm trying to think. That's it. Those are the main devices that I use for fat as well as for skin tightening. Now I have the Elos platform, which has Sublative on it, and I use that a lot for skin tightening, stretch marks, and scars, which goes hand in hand, and we're not talking about particularly combination treatments today, but does go hand in hand, in my opinion, with the skin tightening portion, scars, and stretch marks. So I have that as well.
Do your patients, or is VelaShape treatment painful? Are your patients experiencing any pain during treatment?
I think I had said this a few times during the procedure that my patients say this is like a warm massage. They come in and fall asleep. They honestly, on my Yelp and Real Self reviews, they're talking about my nurse and how much they love her because they sit and talk to her about things they've been doing, their sons, you know, and this and that as I'm doing the treatment. So I'm slaving over the hard work, and they're having a drink of tea and listening to Candace talk. They love it. They seem to love it. Now, obviously, if the radio frequency is too high, and as you're stacking and just jumps the temperature, you could burn someone or cause them to be, you know, sort of a hot spot, I tell them, like a spike. But if you're really monitoring the temperature, the patients love the treatment. They feel like it's a massage.
Great. Okay, one more question here. Let's see. What advice do you give your patients to prolong their results?
So a couple things. 1, I give them a personal trainer. 2, I give them a Pilates instructor. 3, I give them a yoga instructor. And then 4, I have an anti-aging doctor supplementation. Basically, the thing is that to maintain a healthy lifestyle, to get the results and to maintain them, they just got to continue doing the things they should do, which is not going out to dinner every night, choosing the right options when they go, you know, to a restaurant or when they cook at home, exercising. Specifically, the cellulite patients are a little bit difficult because that's more of a genetic thing. So whether that means doing surgery in combination or really muscle toning and losing some fat, that's the most important thing. They really need to diet, exercise, and maintain a healthy lifestyle.
Got some marketing questions here. So do you do a lot of social media? Is one of the questions.
I'm probably the king of social media. You know, it can be a hit or it could be your downfall. I have yet to determine at my stage and my age what that is, but so far it's been very good. I do a lot of social media. We post pictures on Instagram, Twitter, Facebook. I find that Real Self is extremely effective for body contouring. If you're not doing Real Self, you should, and tweet online that I was the one that told you to do it, because they will love me if you do. But I will tell you, a lot of patients ask about these particular questions, the exact same ones you're asking about VelaShape versus other technologies or non-invasive technologies, or what you think is best. And if you're the one to answer that locally, those patients will come to you. And every day I'm getting about 4 or 5 inquiries from online because of these specific devices, and it really has helped boost my career. Now, there are ways to do it nicely or, professionally, and that would be maybe not, taking your shirt off and showing you getting the device procedure done, but it might be, your cosmetic coordinator next to the device talking about it, or putting a video of you discussing the new procedure, or that sort of thing, or results of patients. If you have a HIPAA compliant consent form and your patients are really willing to show either the procedure being performed or their before and after results, it's dramatic. You will get a lot of patients who will come in from that.
Thank you so much, Dr. Emer. So we have a really new campaign that we launched earlier this year called our VelaShape What If campaign. And part of this was to really help differentiate VelaShape III treatment from previous generations of VelaShape. All fantastic treatments, but we've made a lot of technical advances with VelaShape III that are great both for the user and for the patient on the other end. So we wanted to make sure we highlighted that in an exciting way. So one of the things we did with this campaign was come up with something that really touched on what patients were going through. And Dr. Emer described this earlier, where he talked about patients who maybe, they've done the diet and exercise, but they can't get that little bit of visceral, they can't get that, subcutaneous fat that they're looking for. So that little bit on the belly or that little bit on the thighs that they want to get rid of, and they've been doing a million sit-ups. So VelaShape is really the answer to that, and some of the body contouring that he discussed earlier. So we came up with a campaign called What If? And the concept behind the campaign is, what if the fitting room was where everything fit? What if every hallway became your runway? Or what if the sidewalk was your catwalk? These are kind of the things we were playing with that we wanted to get across to patients, and it's a really fun campaign. So the campaign is meant to, again, remind women of that great feeling that comes from fitting comfortably in their clothing, that they can wear confidence with VelaShape III. It asks positive themed questions that really get women thinking about their body goals, and it really helps to reinforce the concept of VelaShape as a way to achieve those goals. So, Dr. Emer and I have worked together to talk about how that helps his practice, and maybe Dr. Emer, you can make some comments on how it's been helpful for you.
Sure. Most of my patients come in wanting to, feel special, whether it's in clothing, and I had elucidated before to sort of Lululemon shorts and Spanx and stuff, and that's because a lot of my patients will say, I don't care what I look like with my clothes off, or I do care what I look like with my clothes off, but I want to look even better with my clothes on, and I see this and that, and I want to do something that makes me feel good. This campaign sort of reaches to them. It makes them think about, what they've been doing at home, whether it's diet, exercise, or meeting with a trainer, but what else can they do to add to their regimen? A lot of people don't know about these procedures, and if they're walking down the hall and see a mirror and they notice a little spot, what else is there that they can do? This campaign sort of reaches out to those people who are thinking about other things that can sort of combine with their diet, their exercise, and their supplementation or workout routines.
So one of the things we did with this campaign, a lot of you may notice, is we really went outside of the box in terms of the look, and we wanted to make sure that this looked very different from any of the patient materials or marketing materials you'll see in most offices. And Dr. Emer and I talked a lot about this when I first showed him the campaign. We've got a lot of pink and bright colors. We're using more exciting fonts. really trying to reach out to different generations in this sense to talk about the treatment. So we really did a different look so that this would stand out in any waiting room, which is so essential when you're trying to introduce a new treatment to patients or cross-promote in any way. So here on this slide, this is kind of an image of everything that comes with your device at purchase. So you'll get a banner stand for your open houses. You'll have your countertop so that you and your staff can talk about treatment if patients are checking in or checking out. You'll have posters, a consult booklet, and we even provide you with some of the digital essentials you'll need to make sure you have e-blast templates and online ad templates to get started. So those are kind of the general pieces. So we're going to go ahead and end the webinar, but we will be sending out this recording to everyone who registered, and we want to thank you all so much for attending. Dr. Emer, if you have any closing statements?
No, I would say, if anybody, I respond to every email I get, and, I'm on every social media site, so if you want to sort of look up what I'm doing, you can take a look at my Instagram, Facebook, Twitter, Real Self, Yelp, and, all of that. But my email is jason.emermd@gmail.com, and I would gladly answer any questions. I don't know if I can call everybody independently, but if you needed to talk to me, I'd be willing to do that. You could ask Caitlin or any other people at Syneron who have worked with me, what I've done. I've been very, very successful, thankfully, with a lot of support, so it makes me very happy, and I can give you an honest answer about all the devices. I mean, the pictures I showed you, those are my patients, and they've gotten really good results. But like I said, I think the expectations are extremely important when it comes to non-invasive devices. There's a lot of things that are out there, and, they all work in certain ways, and you have to utilize the one that you choose or multiple ones you choose in the ways that are going to meet the expectations of your patients. Since I'm doing a lot of surgery, I'm able to sort of integrate that to get an amazing result in my patients. But if you don't do surgery, it's important to think of, how can you market this towards, an increasing demand of people. What's nice is this doesn't have a lot of downtime. This does fit well with the patient's diet and exercise and other routines. It can be used everywhere in the body. You're going to get improvement in fat reduction, in cellulite, and in skin tightening, so it's going to improve all those other things. And as more things are studied, maybe it's helping stretch marks, maybe it's helping scars. There's a lot of other options. So it's one of those things where it's very diverse, it's sleek looking, and it's still one of the newer, it's one of the best, newest technologies.
Thank you so much, Dr. Emer. And thank you, everyone, for attending. And please stand by for your follow-up email for the registration link. Thank you.
Thank you.